Season 2, Episode 1, Thermage. Today we're doing Thermage on Richard's eyelids. As my last patient of the day, having one of my favorite treatments done. So we're treating eyelids, increasing collagen, stimulating new strands of collagen, tightening the old ones, and we're going to start right now. And while I'm treating, I'll be talking, okay? So right now we're going to be tuning the device. So, okay. Please wait, the device always talks to us, so we have to follow some commands we're going to follow. And Richard will be comfortable during procedure. I command you to be comfortable. Actually, we always ask our clients to tell us how it feels. On a scale of 0 to 4, the heat should be somewhere between 2 and 3. So between warm and hot, but totally comfortable. So let's start with the parameters that are usually quite comfortable and effective. So let's start with the first pulse. Here we go. How does it feel?
Good.
Okay. So each pulse delivers some coolness to the skin to protect the skin, and then we deliver the heat of Thermage, which is a radio frequency. As you remember, I treated Richard, we did his face maybe a year ago now, and that was season 1. So now we're doing the eyelids. So it's a very interesting non-surgical modality, and there's zero recovery after the procedure, so it's wonderful in that sense that you can go to your normal activities, you know, you can go to work, you can even go to a party. Probably nobody will notice any pinkness to the lids by then. Usually whatever pinkness disappears in about an hour or so. So, how are you feeling right now?
Good.
Okay, on a scale of 0 to 4, where are you with those pulses?
2.
2? Okay. So we're perfectly where we're supposed to be. And this is a very small tip. As you can see, the surface of the tip is tiny. So it's specific for the eyelids. When we treat faces, arms, chests, upper legs, we treat with a larger tip. And with this tip we can go all the way to the eyelashes and increase collagen strands, which we all lose as we get older. So usually people lose about 1% of collagen a year, and could you imagine, you know, all these years, it's quite a big loss of collagen. So Thermage, which is a monopolar radiofrequency modality, stimulates new collagen strands, and those collagens that are created anew will be lasting for probably about 10 years. Of course, we keep on losing our own pretty old collagen, native collagen, and so usual recommendation is to repeat the procedure once a year to stimulate new strands. How are you feeling? Is it getting too uncomfortable, too warm, or you're good? Okay. So frequently patients ask me how long they will see the results, and it's a gradual improvement. We usually say results keep happening from now, from the start of the, from the beginning of the procedure to about 12 months from now, as proven by biopsies. So it's a wonderful, it's kind of like a gift that keeps on giving. We use coupling fluid, so that's a little bottle of coupling fluid that helps just to align the tip correctly with the skin, protect the skin. How are you doing? Good? Now Richard has an eye shield covering his eyeball. You want to demonstrate your black eye? There we go, for those who would like to see. I usually treat one eye at a time, so I put the shield in and I treat one eye, then remove the shield and then repeat procedure on the other eye. It's just clients are more comfortable with that. This area here on the lateral brow is, on the lateral eyelid is frequently more uncomfortable. But the rest seems like it's good, right? Are you doing well?
So we go on there,
Yeah.
which is okay.
Okay, and I just want to show how we do the lower lid as well. We're not done with the upper lid, but I don't want to take too much of your time. I know everybody's getting ready for dinner, but I'll show you what we do for the lower lid as well. So I'm going to decrease the parameters a little bit. Lower lid sometimes is more sensitive, but Richard, if you are not feeling the heat, please let me know. We'll bump it up again. Okay, so here we go. How we do the lower lid as well. How is the temperature here?
It's good.
Is it 2 or less than that?
Just that.
Just right. Okay. All right. Can you look up, please? Okay. Sometimes the eyelashes are on our way, so. Especially those glued on eyelashes. Fortunately, Richard doesn't have those. But with glued on, they're a little bit on the way, so I always ask my clients to open the eyes during procedure on the lower lid. Okay, and that's how we do it.
So Dr. Marina, we have a few questions coming in.
Okay, excellent.
So how many treatments will I need with Thermage?
It is one and done, and that's another advantage of, you don't need to repeat it. Some other procedures we need to do several sessions to achieve results. With Thermage, on any area, it's one and done. Of course, as I mentioned, aging continues, we keep losing our collagen, the skin is not as firm as it is when it's younger, so we do need to keep up with that aging process, so we recommend to repeat the procedure once a year, but you don't have to.
Great, and what other parts of the body can be treated?
Well, face is very common. Face, neck is a very good combination. Area under the chin, we call it the chin strap, which is right here. We treat chest, we treat abdomen, we treat upper arms. Anywhere where there is skin laxity, we can do Thermage. Above the knees is another very common area to have treatment done. So, yeah, and it's quite comfortable, as you can see. We're not giving any anesthesia. There's no topical anesthesia for this particular procedure, because actually we want patient input.
So you may get to talk.
Well, we didn't say that. All right, back to the upper lid. But before we return to upper lid, would you like to see some before and afters? Of course, not on Richard because he's still being treated, but I thought that it's worthwhile to see some results. So this is the eyelids that were done, and this is 6 months post-treatment. As you can see, it takes time to show the improvement, but there is significant improvement with eyelids on that can be achieved. Okay. Well, do we have any other questions?
How long does the entire face take to complete?
We usually about an hour and a half for the face, and about 45 minutes for the eyelids.
And can I have Thermage if I've had fillers?
Absolutely. It's actually a great complementary procedure. Fillers fill, Thermage tightens, so it's a great combination. And we can do it before, we can do it after the fillers as well. So there's no problem with that.
And how long have you been doing Thermage?
I think over 17 years now, if I'm not mistaken. Seems like forever. How are you doing? Getting hungry for dinner?
Yes.
Yes, like everybody else too probably who's watching right now.
We have one more question that just came in. Is there any swelling involved in the treatment?
There can be a little bit of swelling, a little bit of pinkness, so usually it goes away by the next day. And most people say that pinkness goes away the same, within an hour of the treatment for most people. Of course, everybody's different.
Great. Well, thank you so much, Dr. Marina and Dr. Richard.
Thank you for joining us. Stay tuned for Season 2, Episode 2. Dr. Marina Buckley's eyelids will be treated as well.